Welcome to this education video entitled Life-Threatening Emergencies. This session is a component of our Project Save education video series designed especially for school staff, teachers, coaches, and others in the community that interact with children. Project Save stands for Sudden Cardiac Arrest, Awareness, Vision for Prevention, and Education. My name is Richard Lamphere. I'm a registered nurse and program manager of Project Save with Children's Healthcare of Atlanta, an affiliate of Wisconsin Children's Hospital, Project Adam, and I will be your presenter for this session. This education video is intended for adults who supervise children in schools, coach athletics, have minor children, or family members at risk for life-threatening emergencies. In this presentation, we're going to focus on life-threatening emergencies. If you suspect or are unsure of an injury or illness, call 911 and implement your emergency action plan. For more information on an emergency action plan, view the Project Save All Staff Awareness video or visit the Project Save website. Here are the specific objectives for this education. Recognize life-threatening emergencies. Explain the need for securing help during a life-threatening emergency, and demonstrate appropriate treatment for life-threatening emergencies. We will take a systematic approach from head to toe as we discuss different life-threatening emergencies. For the purposes of this video, we will not be wearing personal protective equipment. However, in the event of an emergency, be sure to have this protective equipment available. Remember to take your first aid kit and AED to all emergencies. For more information on first aid kit supplies, visit the Project Save website. Let's begin. When an individual suffers a stroke, we need to act fast. If an individual has facial drooping, arm weakness on one side of the body, slurred speech, or is unable to speak, think stroke. Call 911 immediately. You need to document the time when symptoms first appear. This is important as it will help medical professionals determine the best method of treatment. A stroke, depending on what part of the brain is being affected, can lead to a sudden cardiac arrest. Be prepared to begin CPR and use an AED. All head and neck injuries should be taken seriously. If consciousness is lost from a blow to the head, call 911 immediately. Remain calm, check for normal breathing, and yell for help. Be prepared to start CPR and use an AED. If the victim is breathing normally, do not remove any sporting equipment like shoulder pads, helmet, or other protective gear. The only reason you will remove this equipment is if CPR or AED is required, or if you need to control bleeding. Try to keep the victim calm and do not move them until instructed by medical professionals. The only exception would be if the victim is in an unsafe location. If you suspect a concussion, remove the individual from the activity. Talk to your child's doctor as soon as possible, or in the case of an urgent concern or emergency, call 911 or go to the nearest emergency department right away. For more information on concussions, please visit the Children's Sports Medicine Concussion Program website listed on the screen. A penetrating eye injury requires immediate medical attention. Call 911 immediately. Do not remove the object. Place a dry, sterile gauze pad over the affected eye and wait until medical help arrives. Blunt force trauma to the head and neck can be devastating and has the potential to obstruct the victim's airway. Call 911 immediately. Watch for swelling at the site of the injury, evaluate any change in mental condition, and check for loss of teeth. We will talk more about tooth loss in the minor emergency video of this series. Bleeding may occur internally or externally. Pay special attention to bleeding from the mouth, nose, or ears, as this could indicate internal bleeding. In children and adolescents, blunt force trauma to the chest, back, or abdomen could occur from falls, collisions, or sudden deceleration. Let's talk about chest injuries first. A common cause of blunt force trauma to the chest may be a seatbelt or a collision on a sporting field, where two participants run into each other, or where an individual is struck by an object like a ball or hockey stick. A blow to the chest can cause a condition known as commotio cordis. If you see someone suddenly collapse after taking a blow to the chest from a ball, puck, punch, or elbow, think sudden cardiac arrest. You need to respond immediately. First, check for responsiveness and normal breathing. If there is no response, yell for help, call 911, and have someone get the AED. Start CPR, push hard and fast in the middle of the chest, and use the AED as soon as it arrives. Blunt force injuries to the chest, back, or abdomen can cause internal bleeding. The location of the blunt force will determine the internal organs affected and the severity of the injury. Unlike a blunt force trauma to the head or neck, internal bleeding is more difficult to detect when the trauma is experienced in the chest, back, or abdomen. One way to determine if the victim is experiencing internal bleeding is to watch for signs of shock, which are increased heart rate, weak pulse, or change in mental status. If internal injury or bleeding is suspected, call 911 immediately. A laceration or cut can quickly turn into a medical emergency if the bleeding becomes severe and is not controlled. Watch this video for techniques to control bleeding. With most cuts, bleeding can be controlled with direct pressure over the wound. Apply the gauze and press firmly to stop the bleeding. If bleeding continues, place additional gauze over the original layer of gauze. Do not remove the first layer, as this will dislodge the potential clots that have begun to form. Wrap a bandage around the gauze. If bleeding cannot be controlled by direct pressure, or if there is a traumatic amputation, call 911 immediately. In this case, you may need to use a tourniquet. Place the tourniquet approximately 2 inches above the site where the victim is bleeding. Tighten the tourniquet until the bleeding stops. If you do not have a commercially made tourniquet, you can consider fashioning one from other objects close by. Consider using a belt, a neck lanyard, shoelaces, or other material you could wrap around an extremity. Note the time of the application of the tourniquet. Commercial tourniquets may have a tab and marker to write down the time. In a mass casualty situation, or any time you use a tourniquet, mark a T on the victim's forehead to alert EMS that a tourniquet has been applied. For more information and instruction on controlling bleeding, please visit the Stop the Bleed website listed on the screen here. Broken bones can be a common emergency in children and adolescents. You may not think a broken bone could be a life-threatening emergency, but a compound fracture or a bone that breaks the skin requires immediate attention. Stay calm and call 911 immediately. Immobilize the extremity that is broken. If you see a deformity, do not straighten the extremity out. If the skin is open, place dry, sterile gauze over the opening. Keep the victim warm and dry. Anaphylaxis is a medical emergency caused by an allergic reaction resulting from exposure to or ingestion of an allergen. The symptoms may start off with a rash or hives, but can progress very rapidly to an obstructed airway. Younger students may describe their initial symptoms as a scratchy throat. Look for a rash or hives, as this could indicate an allergic reaction. If anaphylaxis is suspected, call 911 immediately. Treatment for anaphylaxis is epinephrine, which is administered with an EpiPen pictured here. EpiPens come in 2 doses, one for pediatrics and one for adults. Please be aware of the type of EpiPens you have available and their expiration dates. Remember to hold the EpiPen in the middle of the ejector. I like to say blue to the sky, orange to the thigh. Remove the blue piece and with a nice fluid motion, inject the EpiPen into the middle of the thigh. Hold it in for 10 seconds, 8, 9, 10, and then massage the area for 10 more seconds. 5, 6, 7, 8, 9, 10. Be prepared to give a second dose in 10 to 15 minutes if the symptoms return or get worse. The best treatment for heat-related emergencies is prevention. Proper hydration is the most important factor in preventing these injuries. Water and sports drinks are the recommended fluids to consume before and during exercise. Avoid caffeinated and sugary drinks prior to exercise or playing outdoors. Overheating can rapidly deteriorate to heat exhaustion, then heat stroke with multi-system organ failure. Call 911 if you suspect a heat-related injury. In the event of overheating, the victim may become disoriented or confused. Get the victim out of the direct sun and into a shaded or air-conditioned area. If the victim is able to drink, give them sips of cool or cold water. The victim needs immediate cooling with cool water, wet towels, or even ice water applied to their body. You will need to monitor the victim's temperature with a thermometer, making sure the temperature is coming down and remains on a downward trend. Cold-related injuries may be life-threatening when the body temperature drops. Call 911 if you suspect an individual is suffering from hypothermia. First, make sure the victim moves to a warm, dry place. If their clothing is wet, remove it quickly and wrap them in a blanket or other warm attire. Depending on how low the victim's body temperature dropped, they may have cardiac instability during the rewarming phase. Be prepared to begin CPR and use an AED. Safety around open flames, chemicals, and electrical outlets will help in the prevention of life-threatening burns or thermal injuries. Please familiarize yourself with the safety data sheets in your school or work area. Home safety includes the proper storage of flammables and chemicals. Take a moment to look around your home and garage for any hazardous materials and have them disposed of properly or safely stowed away. If you encounter someone on fire, have that person stop, drop, and roll. If safe to do so, you can smother the flame with a towel or blanket, or extinguish it with water or a fire extinguisher. After the fire has been extinguished, call 911 immediately. Make sure to keep the victim dry and warm. Trained medical professionals should remove the victim's clothing. Do not try to do this yourself. For information on chemical or electrical burns, please seek additional education through Project SAVE or other safety organizations. Seizure-like activity could be a sign of sudden cardiac arrest. In the event of a seizure in an individual who has not been diagnosed with epilepsy, call 911 immediately. Be prepared to start CPR and use an AED. Do not put or attempt to put anything in the victim's mouth. Note the time the seizure started and the duration of the seizure. Try to remember what the seizure looked like. Was it on just one side of the body? Was the entire body convulsing? This is helpful information for the healthcare providers treating the victim. After the seizure has ended, be sure to assess the victim for normal breathing. If breathing is not normal, yell for help, call 911, get the AED, and start CPR. If breathing is normal, turn the victim on their side to prevent potential choking. For more information on epilepsy, view the School Health Epilepsy video at this link. Additional life-threatening emergencies are related to asthma and diabetes. Children's Healthcare of Atlanta has excellent resources on each of these topics. I will simply touch briefly on each topic and the resources available. Severe asthma can lead to a life-threatening emergency. If you suspect someone is having an asthma attack and they are not responding to their individual care plan, call 911 immediately. The Children's Healthcare of Atlanta Asthma Center has excellent resources on the treatment of individuals with severe asthma. Please view the available materials on the Asthma Center website displayed on the screen. Diabetes may become a life-threatening condition if the individual's blood sugar gets too high or too low. Please see the Children's Healthcare of Atlanta Diabetes Care webpage for information on the treatment of diabetes. Remember, the most important step in pediatric first aid is prevention. Always do everything you can to prevent these occurrences. But in the event of an emergency, always remain calm, as your attitude can greatly impact the behavior of the victim. And remember, these life-threatening emergencies require immediate attention. Call 911, retrieve your first aid kit, and get an AED. Let's wrap up this video by looking at the Project SAVE program and end with additional resources for you to use. Please visit our website, choa.org/projectsave, or contact me, Richard Lamphere, at richardlamphere@choa.org, or call 404-785-7201. The Children's Healthcare of Atlanta Project SAVE video series is designed to help you feel confident to help in an emergency and save lives. This series has 5 topics, each available online for you to complete at your convenience. Benchmark CPR AED, which focuses on recognizing a cardiac emergency, providing compressions, and using an automated external defibrillator. All Staff Awareness, which focuses on recognizing an emergency and developing a proper response. Life-threatening emergencies, which focuses on recognizing and treating life-threatening emergencies. Non-life-threatening emergencies, which focuses on recognizing emergencies and preventing them from becoming life-threatening. And Cardiac Medical Emergency Practice Drill, which focuses on the implementation of an emergency practice drill. Please continue with the remaining videos in this Project Save series. You can complete the videos in any order and at any time. Share these videos with others who may encounter an emergency and would like to feel more confident in their ability to respond. This concludes the Children's Healthcare of Atlanta Life-Threatening Emergencies video. For more resources regarding this and similar topics, please visit the Project Save website. From the Children's Healthcare of Atlanta School Health Program and Project Save, we thank you for watching this video.